right, good morning.
Good morning.
Thank you all so much for being here today. I don't have as many jokes, but hopefully I can make you laugh. So I wanted to thank you all for being here and being committed to raising resilient children. But before we raise those resilient children, we have to birth them. So I'm here to talk to you about the importance of childbirth education. As Sarah mentioned before, I'm a childbirth educator, and I've been teaching the Bradley method, which focuses on having a healthy natural pregnancy and then a birth with little or no interventions. Title today's presentation, You Don't Know What You Don't Know. And I have heard that phrase more than a time or two from the students I've taught. Usually by the end of a class series, they're really surprised by how much they've learned, and they can't fathom how anybody could go on to give birth without first taking the time to educate themselves on childbirth. Oh, I gotta find the clicker, hold on. Lots of remotes up here. Okay, our main topics today are the business of medicalized birth, how our choices affect our pregnancy, birth, and the health of our children, and the benefits of childbirth education. So I've been teaching the Bradley method for 9 years now, and it's, like I mentioned, a 12-week course that focuses on a healthy pregnancy and birth with little or no interventions. And I've also been a certified lactation counselor for 5 years, so it really felt natural to add on that certification because you'll see today, after so many of our speakers, how many of these topics tie into each other. So I know that Danielle mentioned a few things talking about during pregnancy, how you can use arnica. So she's absolutely right, and there's a lot of things that you'll see during your pregnancy and birth that tie into breastfeeding and how breastfeeding ties into your baby's health long term. So we'll cover all that today. I offer prenatal education for breastfeeding and then postpartum lactation support as well. My passion is helping families achieve better births through education and self-advocacy. So, first one up is medicalizing a natural process, or how the medical model isn't set up to support natural childbirth. That's me, pregnant at 25 weeks with my first baby 13 years ago. And I've always had a lifelong fear of needles, so when I became pregnant, I was really anxious about having different interventions and needles and things like that during pregnancy and during labor. I was seeing an OB, and I was taking Bradley classes to prepare. And during our birth classes, we did make a birth plan, and we're encouraged to share that birth plan with our care provider. And I learned during classes that I didn't want all the standard interventions. I knew I didn't want an induction, I didn't want an IV, I definitely didn't want an epidural and no episiotomy. And so when I brought that birth plan to my care provider and I showed it to her, it turned out she wasn't supportive at all. She was adamant that I would have an IV. She was telling me I'd probably be begging for that epidural. And it just kind of showed us that we had to really stand up for the birth that we wanted. So long story short, we ended up firing her, and then at 27 weeks, we hired a really supportive midwife. She was amazing, just so kind, and she just welcomed that birth plan. So I went on to have a really empowering birth experience with my first baby, and then got to do it again 3 years later with the birth of my son. So that's where my passion for childbirth education began. When I started down this rabbit hole of learning, I quickly learned why most providers push for those interventions during pregnancy and during birth. And that's because medicalized birth is big bucks. There's a huge difference in the healthcare costs for your normal standard low-risk birth versus a birth that has all of the inductions, the medications, the monitoring, all those interventions. Your care provider gets paid for those, and that's why they tend to push those interventions on moms. There's about a $15,000 difference between that low-risk birth, the natural birth, versus a birth that has all of those interventions. The more interventions you have in pregnancy and birth, the more money your care provider gets paid. They'll use outdated information, coercion, and scare tactics to get you to agree to a lot of those interventions. They're counting on you to blindly follow their recommendations. And a couple who isn't aware of all of their options are more likely to have a medicalized birth. We know that over-medicalized births lead to many unnecessary interventions and surgical births that can have a huge impact on the baby's well-being long-term as well. During our classes, we learned quite a few birth-related terms, and one of those is the definition of natural childbirth, which is childbirth regarded and performed as a natural process without analgesia, anesthesia, or surgery, pretty much the way our great-grandmothers gave birth. We also learned the term iatrogenic, which basically means doctor-caused. either by doing something or not doing something. We know that doctors and medical interventions can be helpful when needed, but are often the culprit for turning a normal, low-risk pregnancy and birth into a high-risk birth. For example, inducing labor unnecessarily may be due to an upcoming due date or the baby's suspected size. So this is your typical birth scenario, and I'm willing to bet if I ask for a show of hands, at least half the people here know somebody who had a birth just like this, or maybe had a birth like this themselves. Usually it starts with an unnecessary introduction based on a due date or provider convenience. Then there's continuous monitoring due to the increased risk to the baby from those inductions. Restricted movement that prevents mom from changing positions to help the baby engage in the pelvis. And then labor stalls, and mom feels more anxious. And usually when she's more anxious, that starts the fear, tension, pain cycle. The fear, tension, pain cycle leads to moms asking for medications, her labor stalls again, she gets more Pitocin to help move things along. So you can really see where I'm going with this. Eventually the baby stops tolerating all of these interventions and often needs mechanical assistance or usually a C-section at the end of that birth. So I've summarized this cascade into 3 main phases. Phase 1 is usually seen when your doctor starts to create doubt or fear around your pregnancy, saying things like, your baby's too big for your body, or your body doesn't know when to go into labor, or even sometimes, if you don't do this, your baby will die. Mom's often made to feel like her body is broken or doesn't work. Then we see phase 2 during labor usually, with augmenting labor with Pitocin, medications, monitoring, limiting your mobility. The general attitude around this birth is your body's dysfunctional and needs our help. Then we see phase 3 as the culmination, where baby doesn't tolerate all of those interventions and they go into distress, thus requires mechanical assistance or a C-section, and mom says, I'm so glad they rescued my baby. In hindsight, during processing of her birth, many moms might start to suspect that some of these interventions may not have been necessary at all. The medical community tends to treat every birth like a medical emergency instead of like a normal physiological process. There's this conditioned view of, well, I didn't go to medical school, so I'll just listen to what my doctor says. And I think that we really need to get away from that kind of thinking because it undermines a couple's intelligence and their right to self-advocacy, as well as their right to explore available options during labor. So what are the side effects of this overmanaged and medicalized type of birth? First is reduced breastfeeding rates. Epidurals and surgical births are linked to reduced breastfeeding rates, partly due to the residual effects of medications and fluids in mom's system interfering with milk production, as well as the increased likelihood of separation of mom and baby after birth. Then there's the effect on the baby's microbiome. Increased labor interventions lead to more surgical births. Babies born via cesarean miss out on crucial bacteria present in the birth canal, and their immune system can be negatively impacted long term. And finally, increased postpartum mood disorders and postpartum anxiety. Mothers who experience birth trauma from interventions, epidurals, and or surgical births are more likely to suffer from postpartum mood disorders. And of course, all of this has a larger ripple effect on your baby's health. Much like that cascade of interventions we see during labor, there's a similar cascade that extends into childhood. Babies don't tolerate those interventions during birth and are born via C-section. They miss out on that crucial gut bacteria. Mom is less likely to breastfeed, thus affecting her baby's immune system long term. Or if mom is able to breastfeed, she often doesn't have the education or support to meet her breastfeeding goals. The United States has one of the lowest rates of breastfeeding. The overall worldwide average age of weaning is about 5 to 6 years, and here in the United States, it's closer to 3 to 4 months. It's no wonder we are one of the sickest countries in the developed world. When we talk about the topic of childbirth education, we also need to talk about unlearning. We've been so conditioned by our culture, TV, and movies to fear birth. We view it as painful, scary, and unsafe for mothers and babies, an experience that can't be handled without tons of medical intervention. And part of the education process is unlearning all of that negativity surrounding birth. It doesn't have to be an experience fraught with anxiety and fear. It can be better. When we educate ourselves on any unknown topic, even one as complex as childbirth, we remove the anxiety and fear around it. So what's a family to do? The power of education. Childbirth education makes a difference. Couples who attend out-of-hospital birth classes are more likely to have a vaginal birth and less likely to need forceps or vacuum assistance, and less likely to have a C-section. Furthermore, moms who have vaginal births are exponentially more satisfied with their birth experiences than those who give birth via cesarean, even 10 years after their birth. I can say in my own experience, it's definitely longer than that. Parents have a lot of choices to consider during pregnancy, birth, and postpartum. A childbirth educator can help you navigate these decisions. Carefully choosing your care provider and asking them questions like, what is natural childbirth to you? How do you feel about eating and drinking during labor? What's your C-section rate? These are just some of the things that couples will need to know. When there's a cooperative relationship between couples and their provider, birth satisfaction is increased. And then there's also carefully choosing your birthplace. Will you birth at home, in a hospital, or in a birth center? You'll want to choose a birthplace that is equipped to handle the type of birth that you're hoping to have. If you choose a hospital that has a 50% C-section rate, you're more likely to have a C-section. Choosing your birth team. Your childbirth educator, your birth doula, your lactation support person, and your postpartum doula. These are all people who will be resources for you during pregnancy and birth, as well as during postpartum. What prenatal tests and procedures will you be consenting to or refusing? Are they all necessary? Will the results lead to further interventions down the road? The power of a birth plan isn't the actual plan, it's the process of becoming educated about all of your options. Couples want to clearly state their priorities in labor and birth on a birth plan. Focusing in on your preferences and priorities for your birth will help you navigate the process, even if something unexpected comes up. Your provider should be made aware of what type of birth you're preparing for, and I'm going to say it, respect your birth preferences. When you're sharing your birth plan with your provider, you'll get a good feel for their views on having an educated couple. If they're receptive and supportive, that's great. If they brush it off or they tell you not to bother with a birth plan, that's a red flag. Having open communication with your provider will prevent a bait and switch situation from happening, as well as build trust in your birth team. Don't underestimate the power of informed consent and refusal. Every test, every procedure, and every medication should be agreed upon before it happens without threats or coercion. These are just some of the decisions you'll need to consider during pregnancy. Right at the top there, we've got the flu shot, the COVID shot, and DTaP vaccines. Some doctors are really pushy about these, despite there not being any evidence for their safety during pregnancy. And wisely, many families are choosing to opt out so that they protect their developing baby. Then we have the GBS swab. GBS is a common bacteria that comes and goes during pregnancy. If you happen to test positive, you'll be told you need to have antibiotics at the onset of labor, which can affect babies and mom's microbiome. We have routine ultrasound. Ultrasound technology has been under investigation since its inception. There's evidence that shows it can heat up developing bone tissue and create air bubbles, which can affect growth. It's also often used to convince families they need to induce early. That's definitely one you'll want to research. Then we have gestational diabetes test. Many mothers are opting to skip the glucola drink that's offered in lieu of a more natural option, or they are testing their own blood sugars at home for a period of time. These are some of the choices you'll want to consider during labor. They include an IV, hep block, or oral hydration. An IV often gives the perception of being sick and is a gateway to other interventions. Then there's vaginal exams during labor. Studies show that the more vaginal exams a mother has, the more interventions she'll have. Vaginal exams interrupt the flow of oxytocin and lead to an increased use of Pitocin, which is artificial oxytocin. Comfort measures for labor. We know there's a ton of natural options for coping with contractions, including massage, hydrotherapy, guided meditation, counter pressure, rebozo techniques, and more. Various positions. Mothers should have the freedom to choose which positions they'd like to labor and push in. And some of you may be surprised to learn that typical pushing on your back position that we see in movies is probably the worst conceivable position to birth in. Eating and drinking in labor. For a long time, we were told it was unsafe for mothers to eat and drink during labor, but now we know that isn't the case. And in fact, women who are allowed to eat and drink during labor are less likely to have a C-section due to maternal exhaustion. A calming environment, which includes dim lighting, relaxing music, soft voices, familiar comfort items, all of these can help a mother feel more relaxed. Pain medications, artificially rupturing your membranes, epidural, and so much more. Those last few I mentioned come with a ton of their own risks, so it's really important that you're educated on those before you go into labor. These aren't decisions to make in the heat of the moment, but rather to be educated on and committed to before you go into labor. It's also worth noting that even in the event of a C-section, couples still have a lot of these options available to them. These are some of the parental decisions you'll be making after birth that you'll want to be informed on. So at the top there, immediate skin to skin, we know how important that is for bonding and breastfeeding initiation. Delayed cord clamping to avoid anemia on the baby later on and ensures the baby gets all of their blood from their placenta and umbilical cord. Family bonding time without interruptions. Delayed or no bathing to avoid the baby's temperature rapidly dropping and helps to protect that microbiome from the vernix on their skin. Eye ointment, which is only necessary if mom has gonorrhea or chlamydia. The vitamin K injection, which more families are declining this after being educated on the risks. The hepatitis B vaccine, which is not necessary unless your baby will be engaging in high-risk behaviors. I can guarantee you they probably aren't. Then we have breastfeeding to nourish the microbiome and the immune system. You'll want to be well educated on all of these topics so that you can advocate for yourself and your baby. Making decisions is easier when we break it down step by step. So I use this easy to remember acronym with my birth students. I tell them to remember to use your brain, or B-R-I-A. Not Brian, don't use your Brian, use your brain. B-R-A-I-N. So the B stands for benefits, which are the benefits to the baby and to the mother, if you choose to do that intervention. The R is for risks, so ask them, what are the risks to my baby and to myself? It's important to remember that every medication and most interventions have a set of their own risks. Also, you can ask to see the package inserts for any medication that they're presenting to you during labor. A is for alternatives. What else can I try instead that may give us the same result? So for example, instead of using Pitocin, how about we try nipple stimulation to get those contractions going? I is for intuition. What's your gut telling you? Don't discount your intuition when it comes to the decision-making process. If it doesn't feel right, there's usually a reason. And then N is for nothing. If there's nothing wrong with the mom and there's nothing wrong with the baby, there's no reason that you can't just stick to the natural process and allow for time and space for the birth to unfold as it's supposed to. And sometimes I like to add on E and D at the end for evaluate and decide. Once you have all of the information from your care provider, you and your partner should have time alone to consider all of that information and then decide without your doctor standing over you, maybe tapping their toes and checking their watch, waiting for you to make a decision. This is a really thorough way to help you process different interventions during labor that might come up. So now that we've covered all of that, let's look at the benefits of childbirth education. Childbirth education gives you the tools to cope with the experience of labor and allows you to know what's going to happen during labor and birth process. We learn and practice comfort techniques to use for each stage, as well as how to make wise choices if there is a variation or complication that arises. Hands-on practice during pregnancy helps couples familiarize themselves with comfort techniques and helps them gain confidence in using relaxation for labor. We also cover how to tell if labor has started, the stages of labor, relaxation techniques for each stage. You won't be taken by surprise and can enter into your birth with a calm confidence. Childbirth education helps partners know what to expect and how to help. In turn, a solid partnership between parents is formed that extends into parenting. So many times during classes, a couple will realize they maybe weren't on the same page about a certain birth topic, and having a safe space to weigh options is really helpful for couples. When a couple begins their parenting journey by learning how to have a safe, happy, healthy birth, their children benefit for years to come. Childbirth education promotes a healthy lifestyle during pregnancy through balanced nutrition, pregnancy-specific exercises, avoiding harmful chemicals, and stressful situations. Many couples report not getting any education at all about how to eat during pregnancy other than what to maybe avoid, but no education on what to eat to encourage a healthy low-risk pregnancy. A low-risk pregnancy for moms means more options during labor, better births for families, and healthy, resilient children. There are a number of different childbirth classes a couple can take to prepare for birth, but in my opinion, one stands out. The Bradley Method is a 12-week childbirth education course that focuses on mental, emotional, and physical relaxation. The partner takes on a role of labor coach to make the experience more connected for families. Families learn everything from pregnancy nutrition and exercise to postpartum recovery, newborn care, and breastfeeding. It's the most comprehensive childbirth class in the area. I'll leave you with this. Whenever and however you intend to give birth, your experience will impact your emotions, your mind, your body, and your spirit for the rest of your life. Thank you.